All right, today we're going to address the question is how do you prevent sacroiliac joint problems or pain or slippage? Many people have SI joint problems, more females than males, because that's typical what happens. We've gone through the anatomy a little bit, and there are some common activities during the day that people engage in that make their sacroiliac joint worse. So one of the more important ones is sitting with your legs crossed. Either sitting with one knee crossed over the other, or with your ankle crossed. So we're going to use this half of pelvis. So this is, here we go. This is the left side of what we've got right here. Okay, so the left side. If I flex my hip and then bring my femur over this way, what happens is it does put some torque on the ilium. So it can open up this sacroiliac joint. So if I'm sitting with my legs crossed, I'm opening up this ilium again and again. So that can be difficult. Now, the contrary to that is if I'm sitting, can you see me if I sit over here? If I sit with my ankle crossed over and my hip is tight, what happens is the restriction in my hip will put some stress on my sacroiliac joint. So sitting with your legs crossed is something that can really irritate your sacroiliac joint. The other thing I've noticed over the years is taking long steps. So in females, SI joint pain is more common. It's not uncommon for females to have a shorter stride length. So when I say stride length, I mean if I advance my right leg, it's about 8 inches between my heel and my foot. That's all the movement in my hip. So about 30 degrees of hip flexion when I take a stride. If I take a stride and I want to keep up with someone who's walking faster, what I may do is then take about a 16-inch step. Well, as soon as I do that, that movement needs to come from either my sacroiliac joint or my low back rotation. If I have a hypermobility or more movement in my sacroiliac joint than might be ideal, then that movement can come from the sacroiliac joint. And if you've ever, and I don't recommend this, but I have with my wife, watched her on the treadmill, you see, you get a lot of translation of those hips. So monitoring your stride length, particularly if you're exercising on a treadmill, is really important, particularly for women that might have sacroiliac joint pain. The other one is, I see all the time, is single leg standing. So if I'm holding, we're going to pretend this is my granddaughter. This is her nose. She's got kind of a big nose. No, she doesn't. She's beautiful. Okay, this is my granddaughter. I'm holding her in my arm, and her legs are straddling me. You see women every day, weight bearing on one side bending their spine, putting force through their hip and sacroiliac joint. So unilaterally standing, particularly holding a baby, can be problematic. Hiking is another one, or going upstairs. So again, if I hike, and we're going to show you over here, if I flex this hip, and I flex it beyond the mobility of my hip, then we're going to get some translation here. And we see that all the time with people that is, if you're stepping up 2 steps at a time, or you're hiking up boulders, or so you want to be careful taking too steep of a step. The other thing that's really important is activities of nightly living. So sleeping posture is really important. And we're going to have our model, Laura, come in. Okay, so we talked about with walking, taking too high of a step. We talked about lying down or sitting with your legs crossed this way. So, for you married folks out there, if you have sacroiliac joint pain and your wife has the pain, or you are someone's wife, and you lie down here and your legs are here, and you guys are engaged in some intimacy, that can be a position that's going to put a lot of stress on your sacroiliac joint. The challenge too is during those kind of activities, you're not thinking about tweaking your SI joint. So if you do have SI problems, it's important to find positions that your low back and your SI joint are comfortable. So one of those would be lying on your side. So let's have you lie on your side in a neutral position. If I have so this is also true for sleeping. If I have a SI joint, the typical position is for this ilium to shift down. So this is coming down. And I tend to sleep with this up and this back. That can be problematic for this SI joint. Okay? And we're going to talk about things you can do for exercises. Thank you, Laura. So keep in mind, you can just stay right there. Okay. Keep in mind that one of the best things you can do to prevent sacroiliac joint, so SI joint problems, is maintaining fitness, maintaining stability, sit up nice and tall, maintaining stability in the trunk, strength of the hips, and maintaining an ideal body weight. So getting involved in an exercise program for trunk stability, for abdominal strengthening, for hip strengthening, and for flexibility of the hips is really important. So the next video, we're going to talk about specific exercises to work on strengthening your core, strengthening your hips, and offering good stability in through your pelvis. If this was helpful, please subscribe, share, hit the like button, and send us in some questions that you might have.